Gainesville, Letcher County is a very unique community. We have farmers and ranchers, we have a top-notch university and teaching hospital. We have a very kind of old hippie vibe in some areas of our community, and so we have some very high, what I call brainiac positions, and very high paid positions, and then we have some poverty, some significant poverty. So it's a wide range of life experience, a wide range of people. Poverty level tends to follow where our government housing has been located, and that's where we see most of our crime happen, most of our violent crime, as well as most of the medical disparities. There's child maltreatment, child abuse, domestic violence.
If you drill down, you can look at it geographically, so you can see that there are certain areas where you're going to have most of your need. And so what happened was that Casey Family Programs, the Department of Children and Families and Partnership for Strong Families all got together and identified areas and said these are what we would call hot spots.
At that time in our state, there was an explosion of children coming into foster care, and we were very concerned about what was going on. And so as we worked with staff in our 13 counties, we began to look at the data to find out, was there a specific unit or a specific investigator, or we're somehow classifying cases differently. We're also looking at zip codes, and to our surprise, the 32609 was one of the zip code areas that had a high level of abuse and neglect reports.
The library, they were looking to open a branch in this Northeast community. We shared that we wanted to provide prevention services in the same zip code. We said, why don't we open a center that's very non-stigmatizing, that's very welcoming and non-judgmental, and that doesn't scream when you walk through the door, hi, I'm going in to get help for problems I have.
People in the northeast part of town, they have very limited public transportation. They don't have cars, so having a place that people could get to fairly easily was critical to the success of the project. We were very sensitive to the fact that it needed to be based in the community, and we couldn't just have a place for you to come and apply for services, because if we were going to have to refer people out, they would never get there.
So we had mental health, we had health care, we had early learning folks, we had child welfare people. And we started coming up with ideas for service provision, and then at the same time reaching out to partners in each of those sectors that could provide that service. Everybody that came through the door, we would have them fill out a satisfaction feedback form where there was room on there to say, did you get what you came for, and what else would you have liked to have seen? As a result, our programming really started shifting and became very patron-driven.
You're so sweet.
Concrete supports. That is often what people, when they first come through our doors, ask for. So that could be a food giveaway, a clothing closet, help with faxing resumes, simple things like that. As some of those needs are met and trust is built, people then will start coming for other programming.
I definitely think that those long-term services, they are the most beneficial, simply because, when you're building that relationship, that rapport, that's everything. Once you have someone on your side that you can trust, the short term, you in and out, from this place to this place to this place, offering help. You never really have that time to establish, any solid, rapport or relationship. They weren't on top of me, then I don't think I would, push myself, as I should. It's some things that I do without pushing, but a lot of things, like school and going back to school, and they kind of motivate you to continue.
The first thing that people said they needed were programming for their children. That included both after-school type programming, but also places for their children to play and things for their children to do. Connections to resources for things like mental health services and other social services without having to go from one corner of the county to get a referral into another corner of the county to actually get the services.
It is amazing how willing the partners in the community are to provide services. There is no charge ever for a service that we provide. So these may be partners that in their other work, they are charging for this service, but when they're here, they do not.
SWAG is a nonprofit group. It's all volunteers. It's very grassroots. It advocates for the people of this neighborhood and the neighborhoods surrounding this area. SWAG already knew that they wanted to bring some sort of resource center to the area, but they didn't have an operating partner yet. And when Partnership stepped up and agreed to be that operating partner, the SWAG Family Resource Center really took shape.
But where do we make the right choices and good decisions at? Is it only while we're here at SWAG? Where else do
We
make
have members of the community that are here as volunteers on a daily basis, and those members of the community have really helped set the tone of what happens in the SWAG Family Resource Center. They very much have helped us make sure that we're engaging the community in a respectful and helpful way. We know because of the success of the Resource Center that place-based services work. They help decrease child abuse and they help increase resources. So that model has given us the credibility and the courage to go after other things. It's allowed us to partner with the health department to create the Southwest Health Clinic right across the street from the SWAG Family Resource Center, and it has allowed us to partner with the University of Florida and numbers of other agencies to begin to create an early learning center.
Any time that you can help a family before things get too bad and that child is at risk, at great risk, it is better not only for the child, first of all, but for that family and for their neighborhood and then for their community. And so I think there's a ripple effect.
The patrons that come here, they open up and they share what's on their heart and they share where they want to go in life, and then I take that baby, that seed form of what they shared, and I try to make it grow. At the child level, we provide weekly services such as the homework help, the science club, Courageous Kids, Girl Scouts, on a continuum. As it relates to the adults, we provide job readiness, we help with self-sufficiency.
I was out of work for about 3 or 4 months already. They would sit down with me and offer resume building skills. Depend on whatever the job was to make sure that that resume fit that particular job, to really push that for you. So they were very hands-on with me. When you don't have a job for a while, you feel useless. You feel like you're not even providing anything for your kids. And every day, my daughter will look at me and say, "Mommy, it's okay. You're gonna get it today and here's a good luck kiss." People are normally by numbers. Whether you're social services, you're a number. Whether it's your social security number or whether it's their ID number, insurance companies, doesn't matter. But when you come to somewhere like this, you're not a number. You're that individual.
It's not like we see them for one thing and I let go. I hold on to see till I can get them to a point of a new level of living, a new outlook on life.
I set up an appointment with Cherie Kelly. I've recently had children at that stage, but I didn't really know much about parenting and children and education like that. She referred me to Early Step for one of my children that, I was telling her I had some concerns about. And, I had financial literacy workshop and parenting workshop that they had. It's a one-stop shop, and so it's nothing like it. I love it, yeah. And in the future, I want my children to grow up in that same thing. If we still here in Gainesville, I want to continue. I want them to know what Cone Park offers.
Since operating our first center starting in 2009, the Library Partnership, through 2015, we've collected data that has shown between a 44 and 58% decrease in the percentage of verified maltreatment in the Gainesville area. And again, that's specifically targeting the zip codes that our resource centers are serving.
When you look at those numbers from the verified maltreatment that was existing before the Resource Center was created, and then you come back 1, 2, 3 years down the road and you watch that kind of red hot spot turn to yellow and then ultimately to green and maybe even disappear, then you know you've been successful, because nothing else has really changed in that area except the creation of the Resource Center.
Every community is different, their needs are different. The fact that we can access funding without a lot of rules around it that tell us exactly what that service provision needs to look like has made all the difference.
I think collaboration has just been critical. I can't stress enough how important it is to have the entire community or broad spectrums of the community be engaged in the child welfare system.
These children go to school with my kids. I see them every day at school when I drop my kids off. They come up and they give me hugs. I want to look at that child and know that they're okay and know that they're going to do well.
If we can form partnerships on a day-to-day, everyday basis, and I'm speaking we as law enforcement, or we as any social service agency, or we as any volunteer, if you get to know a person based upon who they are and what they're about, you find the very simple principle is that we all want the same thing. We want our children to be healthy and safe. We want to be able to live in a community that is safe and has a quality of life.